Star Clinic.
And welcome back to Talk of Alabama. We've got Dr. Chris Dixon joining us this morning. He's from Health Star Clinic, and they provide non-surgical treatments for your back, neck, and joints. And so many of our viewers, so many of us suffer from this. So first, welcome to you, Doctor.
Thanks for having me.
I'm glad you're here. Tell me and everybody else a little bit about the patients that you treat.
We specialize in treating patients with bulging and herniated disc in their neck or back. In addition to neck and back pain, they can have pain, numbness, or tingling shooting into their arms or legs. One of the common themes that we see with our patients is they wake up in pain, go to work in pain, come home in pain, and then it starts all over again, and they're afraid it's going to get worse. They can't play with their kids or their grandkids, and they're afraid that they'll have to have surgery. And that's where we come in, where we can help these patients and these people start to feel better and get to back enjoying life and avoid surgery.
And it's not just elderly people or senior citizens. These are people that are 20, 30, 40 years old, maybe some former athletes that really took a pounding back when they played football, and now they're 45 saying, wow, all that football really, impacted me.
All that adds up. We do see a lot of patients in their 30s, and especially from mid-40s and on, especially the patients that sit at a desk or sedentary. That puts more stress on the spine and the discs. That's where we use our spine reconditioning system and our SRS protocol, in addition to what we use is chiropractic care, disc traction therapy, and then our robotic Class 4 cold laser. We are the only clinic in the Birmingham area to have that. And it's a picture of that right there. What it does is it uses 2 wavelengths of light energy. It does not cut, it does not burn.
Okay.
It helps to reduce pain. One wavelength reduces pain, the other reduces the swelling and inflammation. When we combine that with other traditional forms of treatment, we get very good response in a short amount of time. So our patients, within a few treatments, are starting to feel better, and then they can do the things that they can't do before, like they can stand longer, sit longer, they can get better sleep, and so they're happy because they know within a few treatments this is working.
Now, because it is non-surgical, is there any kind of downtime, or is it just ready to go?
Well, we will actually want our patients to continue to work while they're doing that. There's no usually there's no time off work, unless that work exacerbates or their condition. So there's no downtime, or we have to take a few weeks off of work like you do with traditional surgery.
Okay, that's good to know. And so does insurance cover this, or is it something that is...
Yeah, we are in network with Blue Cross and Medicare. We also we offer a free consultation to make sure you are a candidate for care, because unfortunately we can't help everybody. We've got to make sure that you are a candidate for care, and that we do believe that we can help you and get great results. So we always like to sit down and talk with our patients before we even start to say, hey, we believe we can help you. If not, we also give you our recommendations.
Now, the machine that we just saw, that was the spinal reconditioning, right?
Well, that was our Class 4 robotic cold laser.
That was a cold laser.
Yes.
Okay, so the cold laser then, is that different than the spinal reconditioning system?
That is part of it. So we use the cold laser, we use disc traction therapy, then also chiropractic care and other therapies to...
In combination.
Exactly. We want to take pressure off that nerve, reduce the size of the disc bulge, and stabilize it so the problem doesn't return.
Well, I love this, because so many people that do deal with bad backs are petrified of actually going under the knife. So this is a nice alternative that's non-surgical.
Well, we see about 30 to 40% of our patients have already had surgery, and they're heading towards another one. So we can help them avoid that. Now, we can't get them back to 100% because they've already had surgery, and that's where that free consultation comes in, because we can say, this is something that we believe we can help with. Even if they have rods and screws, we can help a lot of those patients.
And there's a number on your screen, 582-8789, healthstarbham.com. Look them up, give them a buzz, and again, you have a free consultation. So what's it going to hurt? It can only help. Thank you so much for being here.
Thank you.
We appreciate it. It's now time to send it over to Javante, who's standing by.